You just got finished with your Willow MD treatment. Tell us how it went.
Well, first of all, I should tell you I'm the biggest skeptic on the planet, probably. So I saw this little Star Trek-looking unit, and I thought, okay, I'll try it. I've got 25 minutes. So I had a knee injury about 12 years ago. Do a lot of athletic things. Have a lot of swelling all the time on that knee. And flexion, whenever I would bend down, that's always the limiting factor, is the left knee. So put it on there for 25 minutes. Took it off. The first thing I noticed was the swelling had gone. I mean, there was a marked difference of the reduced swelling on the knee right off the bat. So I walked a few steps, came back, did a knee bend, and now I don't know what happened to all that scar tissue. It must be there, but anyway, it wasn't stopping me when I bent down. Usually, when I do a knee bend, the left knee always stops me going down because the rate or the flexion is that's the limiting factor. This went all the way down, both knees. Can't believe it.
So how you feel now, Cliff?
I'm ready to go running.
I have to tell you, I'm so pleased. I had it here on my neck and my shoulder for like 24 minutes, and prior to that, I had about a little bit this range of motion, and now look at me, I can turn my head all around, and I have no pain, which I used to live every day with pain. Normally I took, I don't know, maybe anywhere from 10 to 12, don't tell anybody, Advil and Aleve and aspirin every day because just to manage the pain. And I have not had one single one since I have used Willow, and I'm so pleased.
25 years ago, I had a bad horseback accident and dislocated my shoulder and had to have my shoulder totally reconstructed. And the doctors told me I'd lose 30 to 40% of my range of motion in my right arm. And it was that way for probably pretty close to that 25 years. And I had a couple treatments with the Willow, and it made all the difference in the world. I could raise my arm up and have a lot more movement and rotation and flexibility in it. And I liked it so much that I went ahead and bought one for myself. I used to only be able to lift my arm about this high all the time. That's as high as I could go. And then after getting treated with the Willow, I can go all the way up and move it all around, and it doesn't hurt or anything now. So that's why I really believe in the Willow.
Well, I've had irritating arm and neck pain, and I wasn't sure what it was. But you never want to have any kind of numbing or radiation down your left arm. So we put the product on my neck right here, sat there, and felt a little bit of warmth. And after 24 hours, this is the next day, and I feel pretty good. I'm really surprised. But I guess that infrared lighting and what have you is a good deal. I was very skeptical, but I'd have to say that's made a believer out of me. I think it's a great product.
Over the past 5 years, I've had 2 knee operations, one on each side, which helped for a short period of time, but because of the amount of wear and tear that my occupation as an ER physician occurs with my knees, that the pain has become relatively constant. Over the 12-hour shift on a busy day, we can walk 10 to 12 miles, which really will, over a period of time, wear your joints out. 4 or 5 days ago, I ran into Dr. Ron Shapiro, who does pain management in our emergency department, and we used a device on my knee, which the results were just absolutely incredible. I went from less than 45-degree flexion to over 90 degrees. I've been able to walk without pain. Over the past weekend out on the golf course with the dog in the heavy snow, which would just absolutely tear my knee apart, and I have absolutely no pain.